What is EMPAVELI? Pegcetacoplan.
EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. What is the most important information I should know about EMPAVELI?
EMPAVELI is a medicine that can affect your immune system and can lower the ability of your immune system to fight infections. EMPAVELI may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. EMPAVELI may also increase the risk of getting serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. Serious infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines.
Hi everyone, my name is Jillian and I'm 22 years old. I just recently graduated from college with a degree in communications, focusing on public relations. Shortly after graduating, I started a job in the event planning industry, which I'm super excited about because I get to travel and I love to travel. A little bit about me is I have a dog, Rosie, who I just adore and love to take on walks and play with. I love hanging out with my family, my boyfriend, going to the beach, and I just took on a new hobby of crafting because I purchased a Cricut. In 2019, I started to feel sick, and initially I kind of tried to ignore and discount my symptoms, but they became more serious very quickly. Due to low hemoglobin, I was admitted to the hospital and I got a bone marrow biopsy done. 2 weeks after that, I was presented with the results from the bone marrow biopsy and was diagnosed with PNH and started treatment after. At the time of my PNH diagnosis, I tried to remain optimistic. I told myself, I'm young, I'm healthy, there's a medication to take. I wanted to get started on that medication as soon as possible so I could treat the disease and start feeling better. There were many different factors that drove me to talk to my doctor about starting on EMPAVELI. At the time, I wasn't currently satisfied with the treatment I was receiving. My hemoglobin remained low and I still required transfusions. I was presented with a few articles about an investigational medication at the time called pegcetacoplan, which worked differently than the current treatment I was receiving. I saw on Facebook that pegcetacoplan or EMPAVELI had been approved. I actually found out just within 30 minutes after the news was released. I really wanted to be one of the first people to receive it. After finding out, I contacted my doctor almost immediately and he started all the paperwork. He then determined all the necessary vaccinations I would need to start on EMPAVELI, and eventually I received them all. After receiving all my vaccinations, I started EMPAVELI 2 weeks after that. I had a lot of different expectations prior to starting EMPAVELI. At the time, my hemoglobin levels were below normal and I was still feeling very tired. My doctor and I hoped that with EMPAVELI, my hemoglobin levels would rise. I was also looking for a way to stop going into the infusion center so often. Initially, I was super nervous about the self-infusion process because, like many, I really don't like needles. Luckily, Apellis provided me with the resources to get me comfortable with the self-infusion process. After just 2 weeks of starting on EMPAVELI, my doctor and I started to see an improvement in my hemoglobin levels. Since then, my hemoglobin has remained pretty consistent at around a 13 since starting with EMPAVELI. I actually haven't had a transfusion since I started taking EMPAVELI. Prior to taking EMPAVELI, I spent so much time scheduling and getting transfusions. Now, it's nice because I can do it on my own time and on my own schedule. After my initial infusion, I did get a stomach rash that I reported to my doctor right away, and he helped me with the next steps moving forward. My Apellis Care Educator, or my ACE, provided me with sufficient training on how to self-infuse. In addition to my ACE's support, I was also able to watch an instructional video on EMPAVELI's website. After the help that my ACE provided me and the instructional video on EMPAVELI's website, I was able to infuse all by myself. Now I self-infuse 2 times a week. Once I decided on the times and days that were best for me, it's become a natural part of my weekly routine. As I mentioned before, I am an event planner and traveling is a part of my job. So with EMPAVELI self-infusion, I'm able to bring my supplies and my medication wherever I may need and stick to my schedule. Throughout my journey with PNH, I've always been curious about new potential treatments that are on the horizon. For me, I found it helpful to be open-minded to explore something different if you aren't fully satisfied with the treatment you're receiving. Talk to your doctor about it. It helped me to partner with my healthcare team to find new information. I'm really happy that I made the switch to EMPAVELI. Talk to your doctor and see if EMPAVELI is right for you.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI can lower the ability of your immune system to fight infections. It may increase your chance of getting serious and life-threatening meningococcal infections and serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These infections may quickly become life-threatening and cause death if not recognized and treated early.
You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines. If your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. And you should also receive 2 weeks of antibiotics with your vaccinations. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI.
Vaccines reduce the risk of serious infections, but do not prevent all serious infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever with or without shivers or the chills, fever and a rash, shortness of breath, extreme pain or discomfort, headache with nausea or vomiting, high heart rate, headache and a fever, headache with a stiff neck or stiff back, confusion, muscle aches with flu-like symptoms, clammy skin, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. It is important to show this card to any healthcare provider to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have not been vaccinated against Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B, unless your healthcare provider decides that urgent treatment with EMPAVELI is needed. Have a serious infection caused by the previously mentioned bacteria. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, feeling faint or pass out. The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash.
These are not all of the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections, and the full prescribing information and medication guide at empaveli.com.